Welcome, Minister, and thank you very much for coming here this morning to discuss this very important issue. And I raised the issue of the CHO 3, which is the Midwest, to do with the HSE. And I've come across 3 cases recently, and I'm sure that there is many, many more out there, of where people have received I suppose not very nice letters. It basically says that we've no funding and you're not getting your power chair. These are 3 very significant cases. There's 2 children involved and 1 adult. The adult has a condition, the adult has a condition of a very rare form of dwarfism and actually can't walk very far, so he needs his chair, a power chair. And in the case of the 2 children, one has moya, it's a very rare condition, and the other one has a very rare condition, is in a chair since they were a very small child. And basically they've outgrown their chair, is the biggest issue. And all 3 of them received similar letters along the same lines. And they're saying that there's a lack of funding, they don't know when it'll be available. And I'm really concerned about this because I suppose really it's holding back the health of these 3 people. 1 adult, 2 children. Their families are concerned about it. The children, you know, the parents would take them out quite often, but because they now don't fit the chair, it's very difficult to take them out. And one of them actually falls out of the chair because they're too big for it. So realistically, I suppose, Minister, what I'm looking for is, you know, when can funding be released, and how can the lives of these, I suppose, both adult and children and their families, you know, be brought back to normal, because it is important that this be resolved as quickly as possible. Thank you.
Okay, Gurmagut Kahirluk, Asokton Falta, Maris Canach, and Gurmagut Seanad Éireann as well, for raising this important issue. The HSE provides a wide range of medical and surgical aids and appliances, such as wheelchairs and walk aids, free of charge to medical card holders and people on the long-term illness scheme. Assessment by a relevant health professional is required to community-funded schemes, is a collective name for all of the many products, supports, supplies, appliances and aids that are provided through community services. There are a variety of products and services provided under the schemes. These products and services play a key role in assisting and supporting service users to maintain everyday functioning to remain living in their homes and local community. They also avoid the need for hospital presentation or admission while facilitating early discharge from hospital back into the community. Each community healthcare organisation, or CHO, operates standard processes for the allocation of funding for medical and surgical aids and appliances. At times, due to the demand for resources exceeding the available capacity, waiting lists may apply for some categories of items provided through the medical and surgical aids and appliances budget in a particular CHO. CHOs undertake a range of initiatives to ensure optimum use of resources, for example through the efficient recycling of stock items such as walking aids. In the CHO Midwest, there is currently a waiting list in place for the purchase of 25 powered chairs. It should be noted that the waiting time varies depending on the priority rating, a rating which is made by healthcare professionals based on clinical risk. Priority is given to clients with the greatest level of clinical need. In addition, in CHO3, work is progressing on the establishment of a stock database to maximise recycling of stock items across the Midwest. Under the Aids and Appliances project, data will be transferred onto an online system, allowing access to clinicians to review all stock online and validate waiting lists and use recycled stock more efficiently. At national level, in the HSE, a service improvement programme has been established to improve the standard and quality of the many products and services provided as part of community-funded schemes, and to implement standardised national contracts for the supply and pricing of these products to ensure best value for money across all CHOs. These measures will help to ensure that there is equitable access to products and services irrespective of where the service user lives.
Brief supplementary. Thank you, Minister.
And I suppose the main kernel of the problem here is, and it all sounds very well that everything has been assessed and there's a waiting list, but the lives of these 3 people have been impacted. And now I hear there's 25. I'm not sure how many more of them are, you know, but I've had contact from 3 of them. What I'm really concerned about is that they have no quality of life. They can't do what they're used to doing every day. I understand, and even from your reply, Minister, you know, I understand in other health board areas or other HSE areas that they're actually more or less get their wheelchair straight away. It depends on how many people are on the list. Is there any hope that some of the funding that's maybe sitting there not being used in other areas could even be transferred, you know, on a temporary basis, a swap over, because it's not fair that there's 25 people waiting in other areas. There's no, or little or nobody waiting, is my understanding of the situation. Now, I know that's hearsay, but, you know, I mean, some of these people have spoken to people in other health areas and they got their chairs straight away. So, I mean, there is a problem and the funding has to be found, and that's what I'm asking for today.
Minister.
Thank you.
Okay, yeah, thank you, Senator. That's a very fair point. I will undertake to go to Minister Harris following this debate and have a conversation with him about this issue and try and get a handle on the national picture to see. I appreciate the answer I gave us very much on CHO3 based, but you make a valid argument that if there is maybe better alignment with all the 9 CHOs and a better streamlining of the available funding, that maybe there could be better utilisation, and ultimately we want to ensure that not just the 3 you're referring to, but that the 25 people on that waiting list in the CHO3 are seen to as quickly as possible. So I certainly will have the conversation with Minister Harris to try and undertake a conversation with the HC nationally on this issue to try and get better alignment between the CHOs to better utilise the system. You know, each CHO doing their own work on their own isn't going to solve the issue. I think there might be better collaboration required there. So I certainly will do that for you, Senator. Okay.
Thank you, Minister.